Computer. Good. I just want to re-announce our theme today is the shoulder girdle, and today is February 6, 2021. And just remember our somatic guidelines. We're going to move, in general, we're going to move slowly. Today, sometimes we're not going to move super slowly because we're going to do more what in our work we call means whereby, where we're moving to feel something more than moving pendicularly, which is pendiculation move, and I'll explain it as we go along, is more to work with the motor cortex of the brain to actually reorganize a pattern. So we're going to, but always move comfortably and no forcing, back away from pain and discomfort. If you have medical directives, please follow all medical directives. Okay, so let me go ahead. I'm going to go ahead into screen share. And, oh, I've got to, let me come out of, all right. I've got to, whoops, I did it wrong. I've got to, uh-oh, what did I do, Isaiah? I did so, okay, here I am, I'm back. I have to change this. I've got to go back into screen share and share. Okay, here we go. So I need to minimize this and bring this up. Technology. Okay, so here's our first slide. And the shoulder girdle has certain bones and joints. It has the clavicle or collarbone. We have one on each side. It has the scapula itself, or the shoulder blade, and we have one on each side. Here's the back of the rib cage, so it's a little easier to see the shoulder blade or scapula. I love this picture from the Diamond book, Moving Anatomy or something like that. And you can see the clavicle and the shoulder blade. The scapula or shoulder blade has the socket for the shoulder joint itself. And then this humerus bone, the upper arm bone, goes into this shallow socket. I like to include the humerus bone along with the scapula or shoulder blade and clavicle or collarbone, because without the humerus, you don't have the other bone of the joint so that you can't move your arm. And there are a number of joints in the shoulder girdle. So I'm calling the scapula, the clavicle, and the humerus the bones of the shoulder girdle. Now, what about joints? Well, the scapula itself floats over the ribs. It does not have a joint capsule per se, but it's multi-directional and it can go in all kinds of directions over the rib cage. The clavicle or collarbone, which most people don't ever look at, has two very important joints. One over here at the medial end, which is attached to the top of the breastbone or the sternum, and one at the lateral end, which attaches, actually, this is part of the scapula. This is the acromion process, or the tip of the shoulder. These are highly movable joints, especially this one. And we'll do a little bit of clavicular or clavicle or collarbone movement as we go along. And of course, there's the shoulder joint itself. So those are the main joints of the shoulder girdle and the main bones. Shoulder girdle as a girdle is highly movable. And when people say, oh, I have a shoulder problem, or I hurt between my shoulder blades, you have to start with the organization of the spine and the trunk. Now, so here's our spine. Our trunk is this rectangle, and we did a lot of trunk work last month in our class. It does hold the shoulder joints and it does hold the hip joints, the trunk, but it has three main parts: the rib case, the somatic center, and the pelvis. The use of the shoulder girdle, what we're really looking at is the use of our hands. It's our hands that are the active element. It's our hands that have to throw a ball or hold a racket or work a golf club or work a broom or dig a hole or grasp or push or pull. And so the hand is the distal end of the shoulder girdle. The root of the hand is the scapula. And when we are working with our shoulder girdle, we have to have the support and the synergy, the support and the synergy of our spine and our trunk. So a lot of people think I have a shoulder problem, I just have to work in the shoulder. Well, actually, first you need to work with your spine and trunk to get some better alignment in the spine and trunk. So your spine and trunk can offer the support and the control from which your shoulder girdle, your arm, and your hand can operate. So it is our hands and our limbs. Our limbs are our arms and our legs. They need the support and the control of the spine and the trunk to move with ease and efficiency. And the root of the hand is the scapula. And the root of the scapula, in my opinion, is the whole body working synergistically. Now, we use and misuse our shoulder girdle down through our hands a lot. And when we are working with our shoulder girdle, we have to look at the spine. Let me call your attention to a couple of features in these pictures. Here you see a very, very arched posture, arched forward. Her pelvis is an anterior tilt. It's spilling forward. Her rib cage is focusing upward. It's in a posterior tilt. Her legs are very stiff and hyperextended at her knees. Her knees are pushed back. And when you push back your knees, when you lock your knees, you lock your pelvis. You cannot have a synergy of your spine and trunk to support the movement and ease in your shoulder girdle or down through your hand if you're locked up and stiff in a very imbalanced posture. Here's a very, what we would call in our jargon, a red light person, very stooped over into a curl. She has to use a cane for balance. It's great. She's out there walking around. You can see how cantilevered her head is. In this case, her head is over the ankle of her forward walking leg. Her rounded shoulders are coming forward, just like her pulled back shoulders are heading in a backward direction. Her shoulders are in relationship to her rib cage, her somatic center, and her pelvis. Nothing is in alignment in terms of the spine or the trunk. You can't really quite imagine her doing very much with her hands and arms. She can come forward a little bit with her arms. She probably can't raise her arms hardly at all. And she probably can't bring her arms behind herself hardly at all. Some people are born with various kinds of scoliosis. I've worked with clients with scoliosis who can do everything because they keep their body as mobile as possible. And you'd hardly even know that they had scoliotic curves, but it does make a difference. And one of the things about different kinds of curvature in the spine is that automatically that's going to imbalance the shoulder in some way. So we have a high shoulder, a low shoulder, and we have a high hip and a low hip. We have a very short side and we have a long side. All of that positioning is going to change our use, not only in our shoulder girdle and down through our arms, but often in our head and neck and in our pelvis and in our legs. Here we have a person with folded arms. Now, there's nothing wrong per se to fold your arms once in a while, but if it is your habit To stand or to sit for long periods of time with your arms folded across your chest like this, it's going to start projecting your shoulders forward. It's going to narrow your chest here. Your upper third of your back is going to be over broad or over wide compared to your chest. So this is not a good habit to have if it is habitual. Here we have high heels, presents all kinds of problems. Here the high heels is causing very much of an arch. Here the high heels is actually putting her whole shoulder girdle and her rib cage and most of her somatic center behind her pelvis. Here her shoulder girdle is in front of her pelvis. Here's our slumping posture, another bad habit. I have to catch myself a lot when I'm long hours at the computer and re-straighten myself. The cantilevered head, the shortness in the front, the overlongness in the back, a lot of contraction in the abdominal muscles, shoulders very, very forward in relationship to an aligned spine and trunk. Here you see forward head, reading the head forward. Here you see a very nice upright posture. She's holding what she's reading up, so her eyes are almost level. And I don't know, this is kind of poised and strange, but way overarched. And I don't know, I keep thinking maybe she's lost some of her eyesight and she has to keep putting the thing farther and farther away for her to see. And then the stoop posture, something heavy on your back, shoulder bags, lots of books. We have lots of ways we get out of balance and we misuse our posture and our shoulder girdle. We become a lot less efficient, and we can come out of this. Now, of course, we can have injuries and surgeries. There's so much we can do to recover functional movement in the shoulder girdle. Okay. Let's actually, I think I'm going to come out of screen share for a moment. We're going to do some movement in the chair, and we're going to start with just looking at the position of our shoulder girdle, just based on how we move and change our movement in our spine and our trunk. So I'm going to move backward. If you want to see me, that's fine, because I will be doing some demonstrating. If you want to see more of yourself, you can pin your own picture. In your picture, at least on my computer, there's a little square with 3 dots. And if I press it, one of my choices is pin. And that makes my picture large. So if you want to see yourself, then you're welcome to pin. You don't have to do that. You can be in gallery view and look at everybody. You can be in speaker view and look at me. Okay, let's start with our arch and curl. Many of us have done this many times. We're just sitting, our feet are on the floor. We're relatively straight and comfortable. And we're going to start arching our low back by moving in front of our sits bone. And then we're going to curl and come behind our sits bone. And as we arch, you can see it's natural to bring your shoulders backward. And now we're narrow in the back and the upper third of our back, and we're broader in the front. Our shoulders are backward behind us relative, for example, to our rib cage, and it may or may not be relative to your pelvis. And then when we transition to a curl, and you can emphasize your shoulders a little bit more. So if you're sitting slumped, you're sitting in a curl. Now your shoulder girdle is rounded forward, you're narrow in the chest, you're broad in the back, your shoulders are forward of a lot of your rib cage, your somatic center, and in some imbalanced way in relationship to your pelvis. So just when you're doing this on purpose, when you're arching and curling on purpose, you're letting your shoulder girdle come along. But if you're stuck here or you're stuck here, then you're having an issue not only in your spine and trunk, but you having an issue in your shoulder girdle. Let's rock a little bit side to side. Now you have to be able to rock. If you have trouble rocking, you can help yourself a little bit. Let's see if this will do it. Not quite. Let me see. There we go. Okay, if you're having trouble rocking, if I press my right foot down, I can push myself onto my left sits bone. And I can come back to center. If I push myself with my left foot, I can rock onto my right sits bone. If you have trouble finding the weight shift of rocking in sitting without using your feet, then use your feet for right now. And rocking side to side, a lot of us are out of balance to one side. We're going to go into a C curve. So I'm going to rock my weight onto my right sits bone. My left hemipelvis, the left half of my pelvis, is going to either lift or lighten. And I'm going to go with a C curve today. There are different curves. I'm going to bring my left ear and my left shoulder, my left armpit down towards my raised left hip. And you can see this gives me a high shoulder and a low shoulder. And the same will be true if you rock yourself on your left sits bone. Your right hip is higher. We're going into the C curve. My right armpit is coming down. My right ear is coming down. And I've got a high, low shoulder. And a lot of us stand in various ways that we are imbalancing our spine in a curve, and we're getting stuck with a high, low shoulder. What's interesting about this posture in the shoulder girdle, clients will come in and they'll say, I just, this shoulder's high, this shoulder's low. I don't know what to do about it. We're often drawn to the high shoulder. And yes, the upper trapezius is playing a role. But I go right here to the somatic center. And if I can help the person release these muscles so their pelvis can even up, often their shoulders even up quite a lot. And you still may need to do some work, but the position of the spine and trunk is already programming our shoulder girdle to be in certain positions. And the problem is if we get stuck in those positions. Let's look at the last movement, the last two movements of the spine and trunk, and that is rotation. We're going to rotate our head, neck, our rib cage or somatic center. It's up to you if you want to bring your pelvis along, but we're rotating to each side. If I rotate to my left, now my right shoulder is forward, my left shoulder is backward. I could be stuck in that rotation, or I could rotate to the right. I could be stuck in this rotation. I'm exaggerating a little, but you see people rotated, like that. That's not uncommon. And then their head does different things to try to keep balance on themselves. But now I have a forward shoulder and a backward shoulder, and I don't even know it. I'm unaware of it. I'm stuck in a rotational pattern. And in fact, most of us are stuck into some level of a rotational pattern. Okay, let's move on. Okay, I want to go back into screen share. And let's look at a little bit about our head and neck in relationship to our shoulder girdle. So here's our upper trapezius muscle, very large superficial muscle. It attaches above your occipital ridge, way up into your skull. And it attaches to what's called the spine of the scapula. This is a free border. And it attaches, this is the nuchal ligament along the spine of the neck, and all along thoracic 1 to 12, the trapezius, not just the upper, the whole trapezius attaches along the spine and by its ligament up into the skull. You have a huge amount of attachment into the shoulder girdle spine of the trapezius to the shoulder girdle. And you can't see it in this picture, but in this picture, the upper trapezius actually comes forward over the shoulder. And this is your clavicle or your collarbone, and it attaches to the lateral third of the clavicle in the front. So we have attachment of the trapezius on the clavicle. We have attachment of the trapezius on the scapula. What you do with your head and neck make a difference in your shoulder girdle. We're going to work with the upper trapezius in a moment. We're going to work with the levator scapula. The trapezius attaches out here at the tip of the shoulder, but the levator attaches to the medial upper border of the scapula, and then it attaches, you can't tell, but here's the spine, and spine has these transverse processes, and the levator attaches to most of the transverse processes, and you have, of course, a levator on each side. And the last neck muscle we're going to work with is the sternocleidomastoid, SCM. We just call it the SCM. The SCM attaches into the skull, and one of its heads attaches right into the top of the sternum or breastbone, and the other head attaches right into the clavicle. So how we use our head and neck just with SCMs, levator scapulas, and trapezius muscles makes a great deal of difference how we hold our shoulder girdle. So let's just do some shoulder movement, some head and neck and shoulder movements while we're here. We're going to do a very simple upper trapezius movement. We've done all kinds of upper trapezius movements in various classes. Today, what we're going to do is, and this we will work pendicularly, which means we will move into the contraction comfortably, and we'll slowly release out of the contraction into our resting length. So you're going to pick up both your shoulders, slide both your shoulders up and tip your head back, and then slowly release, letting your shoulders come down. You're not pulling them down, head back to center. Let your breathing be comfortable and easy. I like to inhale as I elevate my shoulders and tip my head back. I'm contracting particularly the upper portion of both upper trapezius muscles, and slowly come down. And again, coming up and slowly down. Now I can get the front of the upper trapezius, this lateral third of the clavicle, come along with me for the more red light anterior upper trapezius. Bring both your shoulders, round both your shoulders forward, bring your shoulders up, and bring your head forward and slowly release. And now you're getting anterior upper trapezius. Shoulders rounded forward, up, head forward, just stay in comfort. Slowly release. One more time, round your shoulders forward, bring them up, head forward, slowly release, and relax. Great. Okay. Let's go to levator scapula. This is a little trickier. It's a very deep muscle. This is my right side. It's going to look left to you. You can do whatever side you want to do. You're going to bend your elbow and bring your upper arm, your humerus bone, right next to your spine, next to your body, and start to bring your elbow, inhale and gently arch, and start to bring your elbow a little behind you toward your spine, and then let your head kind of turn and tilt backward. And here's what you really need to do. Bring your shoulder and arm up. So you're in this position, and then slowly release. I'll go through that again. Bend your elbow. Inhale, begin to arch, bring your elbow behind you towards your spine. This is the part that you're going to lift. Go ahead and lift it now. It automatically starts tilting your shoulder, and bring your head back. That's levator scapula. Slowly release. I think because of time, I'll just do 2 of them. Let's go to the other side. So I'm going to do my left levator. Bend your elbow. Inhale. As I begin to arch, I bring my elbow back towards the spine. I raise up my arm and shoulder. My head already begins to tip, but then I tip it backward. and slowly come out of that. One more time. Bend your elbow. Inhale, arch, bring your elbow a little behind you. Your head already begins to tip. Bring your shoulder girdle up and tip your head back more if that's comfortable. And slowly release and relax. And just notice how you feel. It's nice to have more time in between to feel the effects. We've done upper trapezius and levator scapula. Let's do the sternocleidomastoid, the SCMs. Okay, this is my right SCM. My right SCM turns my face to the left. Take your left fingers and put them on your right SCM. Turn your face to the left. And if you don't feel it yet, go ahead and tip your head down. And I don't know, Isaiah, can they see this in the picture, how contracted and bulged out this is? You can feel it. Attaches into the skull and down into the sternum and clavicle, and slowly come back to center. I'm putting my left fingers in the general area of my right SCM, turning my head right. I can already feel mine because it already carries a lot of contraction. And then tip down, and now I'm really shortening and contracting it. And slowly come back to center. Now I'm going to take my right fingers. I'm going to put them on my left SCM. I'm going to turn my face to the right. Tip my head down. Can they see my left one?
Yeah.
Okay. You can see, you might not be able to see both heads, but it's a huge muscle all the way up into the skull, all the way down to the top of the breastbone and the clavicle. And come back. And I can't remember if that was one or two. Let's do one more. Turn your face right, tip your head down, and palpate that contracted SCM, and slowly release. And relax for a moment, and perhaps you feel you have more neck. Your neck is longer. Maybe your shoulders are somewhat down and more balanced front to back. Okay. One more slide, a little bit more lecture, and then we'll lie down on the floor. Let me go back into screen share. And so just another look, here's upper trapezius, what we just worked with. That was when we brought both shoulders up. Here's the levator. Here's the sternocleidomastoid. Okay, let's go to, okay, it's a bit confusing, but I'm going to point out a few things. When you look at the backside in an anatomy book, when you look at the backside of the body, not the neck muscles as much, but all these muscles, superficial muscles, it's you can see it here better. Trapezius, here's your latissimus dorsi. On this side, they've, taken off the trapezius. They've kept on the latissimus dorsi. These superficial muscles of the back are all shoulder girdle muscles. They're shoulder muscles. Your lats, your latissimus dorsi, starts at the front of your arm, and attaches all the way down to your tailbone by its tendon. So it attaches your arms to your pelvis all the way through your back. Here's the scapula. Here's the scapula. Let's go to this side. You can see the fascia covering the infraspinatus muscle. But now let's come to this picture. Here's the medial border of the scapula. Here's your spine. Here's your rhomboid muscles. Now go ahead and gently squeeze your shoulder blades towards each other. You're contracting the rhomboids on both sides. Your shoulder blades are coming closer together, and slowly release. This is your serratus anterior. It's going to work with your pecs. If you round your shoulders forward and actually bring your shoulders closer together in the front, you are bringing your shoulder blades further apart. And your serratus anterior is a major muscle doing that. and that's a protractor. It's bringing your shoulder blades apart. We have pec minor. I know it's a little hard to see, but this little coracoid process in the front of the body is part of the scapula, and it's underneath the pecs, what we think pec major, and it attaches at this little process that sticks out in the front, and it attaches to ribs, usually 3, 4, and 5. It can be more when you do a dissection. Not everything is like the book, but it is bringing your shoulder. I think actually I'll come out of screen share. We'll do some of these movements, and then maybe we'll go back and we'll look at the pictures. Let's do some movements with when we move our scapulas, our shoulder blades, we're usually moving our shoulders. And we're usually moving our clavicles, which we don't really pay attention to. Let's just do some movement. We are going to pay attention. I've got my handy scratch stick to the shoulder blades back here. Yes, your shoulders are going to move, other things are going to move, but let's pay attention to the movements of the scapula. When you bring your shoulders up and down, focus on your shoulder blades. Shoulder blades are coming up, shoulder blades are going down. And you're just doing it as a means whereby, or just a range of motion comfortably to feel. This is about sensory awareness. When you do a means whereby, feel your shoulder blades elevate, feel them depress. Okay, now bring your shoulder blades toward each other. That's called retraction. Bring your shoulder blades away from each other. That's protraction. So when your shoulder blades get closer together, retraction. When your shoulder blades get further apart, protraction. Okay. Bring your arms out, bend your elbows, and put your fingers on or near your shoulders. Now, if you bring one shoulder socket up and one shoulder socket down, you're positioning your shoulder socket up on this side, down on this side. Your shoulder blades, your scapulas, are moving over your rib cage. We call the up shoulder upward rotation of the scapula. We call the downward oriented shoulder joint downward rotation of the scapula. Yes, your shoulders are moving too, but your shoulder blades have to be able to rotate to do this on your ribs. Okay, so let's see. We've done, I want to make sure I'm getting all the different motions, upward and down. Okay, protraction, upward, downward. Good. Oh, this very important one. I can bring my shoulder forward and backward. Forward, almost literally straight forward, backward. I'm going to go to the other one. Forward, backward. The forward motion, this is rounding your shoulders forward. This is bringing your shoulder forward. It's not a very big move. I'm adding a little bit of force so people can see. This is your pec minor in the front underneath your pec major. When you bring your shoulder back, that's the lower trapezius. And that pair gets stuck a lot, especially when our shoulders are rounded forward. We're also bringing them forward, our pec minor to our lower trapezius, pec minor, lower trapezius, forward, pec minor, back, lower trapezius, other side, forward, pec minor, back, lower trapezius. This combination, we have certain muscle oppositional complementary muscle pairs. And one of them that's very important for the shoulder girdle is pec minor to lower trapezius. Okay, let's go to the shoulder joint. Now, our shoulder joint was moving in a lot of those, and we're going to move through our arm bone into the shoulder joint. And we have flexion and extension. All right, hold your trunk rigid. And then start to bring your arms up into flexion. And on me, right about here, I start feeling a kind of a thickness and a resistance. And when I come, and if I'm holding my trunk rigid, if I come back, starting about here, I kind of feel a resistance in the back of my shoulder. But if I let my spine and my trunk flow with the movement, now, if I raise my arms and come along with me into flexion, and I allow my spine to arch, and I look up and I use my eyes, I can come all the way up into here without stress. Don't hurt yourself, just go as far as is comfortable for you. And then as I come down into extension, if I begin to curl like I'm going to dive, I can bring my arms all the way back here into extension. So using your trunk and spine is absolutely crucial for the support and the synergy of using your shoulder girdle. That was flexion and extension of the shoulder joint. Okay, we have abduction and adduction. And I want to give a caution. When you abduct, when you get to about here, it's best if you start turning your palm towards your head as you continue. This is all that was abduction. Coming back down this way, this is adduction. Abduction. Now, it is many people say, oh, well, I don't have a problem. I can keep my palm like this all the way up. You're going to go bone on bone in your shoulder joint, and you may not feel it right away or while you're young and healthy, but you're going to start wearing away your bone, and you are setting yourself up for problems. So when you can remember, you want to start doing that natural turn if you come higher than 90 degrees. So now, you know how when you were kids, you played airplane? One side was abducting, one side was adducting. Now this side is going to abduct as this side is going to adduct. And you can see, I'm making a C in my spine. I'm using my spine and my trunk so that I can freely use my shoulder girdle. I'm going to get full use when I use my spine and trunk. Okay, we have, one more set, horizontal flexion and extension. I'm determined to have a half an hour of movement on the floor. We have 5 minutes before a half an hour more of movement. For horizontal adduction, abduction, bring your arm up to about 90 degrees and cross over. And this is horizontal adduction, horizontal abduction. You have to be high. If you have a shoulder problem and you can't go high, you can do it lower, but the actual range of motion movement is almost about at the level of your clavicles or collarbones. Okay, now once again, if you hold your trunk stiffly and you come across, I can come across to about there, and then I have kind of a pulling in here. And if I hold my trunk stiffly, I can go about, well, right about there, I start to feel a pull. But if I rotate with my horizontal movement, I can go a lot farther. So now, as I go across, I'm going to rotate. And as I come into horizontal abduction, I'm going to rotate my spine and my trunk and my rib cage. So you're using your spine and your trunk positioning as the support and the control for your shoulder girdle movements. Let's go with the other side. Let's just go right into the full movement. As you reach across, rotate. Well, actually, it's good to feel the stiffness because then you believe it. Hold yourself stiffly. Come over with, oh, I'm holding myself stiffly. I forgot. Stiff. I can go about there. I can go farther if I really force it, but I'm not going to force it. And I can go to about here. So now I'm going to rotate, and I'm going to rotate. And I've got a much larger range of motion in my shoulder girdle because I'm allowing my trunk and spine to come along. Let's just take a little look at the clavicle. Okay, let's look at, actually, I think I'm going to come back to this picture. It might be a little bigger. Here's your clavicle. This is, okay, this is the right clavicle. Doesn't matter. Okay, look at the clavicle. I'm going to come out of screen share so I can show you what you're going to be doing. But we're going to especially be working with this joint. So we're going to put our fingers right around this joint, and we're going to feel the movement of the clavicle. Let me come out of screen share. Okay. So here's my two clavicles. I'm going to take my right hand and I'm going to put it at the medial end of my left clavicle, right at the kind of bumpy area. I'm using several fingers. And I'm going to bring my left arm out, and I'm just going to bring my left arm up and down. And can you feel the movement at that? It's called your sternoclavicular joint, sternum, clavicular clavicle. And can you rotate your arm up, inward and outward, and feel your clavicle rolls forward, your clavicle rolls backward. Highly movable, highly movable. It has to be. Now, for all of this to work, it's like a mechanical yard arm. Okay, now, as you bring your arm across, this is my left clavicle, my left arm, my right fingers on the left medial clavicle. I'm gonna, as I come across, my clavicle, my left clavicle is gonna travel into my fingers toward the right. And as I come into horizontal abduction, my clavicle is going to slide a little to my left. And I can use my fingers to free that clavicle a little bit. As I come across, my fingers are giving some resistance to the clavicle. And as I'm going into horizontal abduction, I'm gently pushing my clavicle a little bit to the left. Here, I'm going to give it a little resistance. So I'm making the muscles that are working this motion work a little harder to free up the sliding and gliding in my clavicle. And I'm doing one side, feel the difference. If you've just done one side, you may be able to just sense a more opening because you've unstuck your clavicle a little bit. And we can do it with the other side. Left fingers to the right medial clavicle. And I'm going to come across, and I'm going to come into horizontal abduction. As I come into horizontal adduction, I'm giving a little resistance to the clavicle sliding to the left. And now as I come this way, I'm going to kind of push my clavicle a little to the right so that I can help to, this one on me, my right clavicle is a little bit more stuck. They're both moving, but I can feel, plus it hurts a little bit. I've got some tenderness, which is always a sign. And I can feel that this motion that I'm doing with the little bit of, quote, massage work or fascial work is really helping my clavicle. So that's a little piece about the clavicle. And now let's organize ourselves to lie down on the floor. So give yourself a moment to push your chair out of the way. And it's up to you if you want me to be able to see you. I can see a few people at a time because I'm not in gallery view because I don't want to record you for the recording. But I have these little arrows and I can periodically look at people. I just can't look at everybody. Okay, so you want to get yourself comfy on the floor. If you like a pillow behind your head, that's great, or a pillow under your knees. You want to take a few seconds to settle in and to organize yourself so you're comfy. Good. Okay. And your legs can be long or they can be bent. Let your face relax. Let your breathing be comfortable. Bring your arms down somewhere on the floor. And go ahead. I like to bend one leg at a time. Some people are getting some pillows ready, which is good. And even if it takes you a little bit longer to situate yourself, that's fine, because we're going to start with our arch and flatten. I'll guide you through that. Knees bent, feet on the floor. And your buttock stays on the floor as you inhale and arch. You're rolling towards your tailbone. Your lower back is lifting a little bit. As you exhale, you release your back. You gently contract your belly so your pubic bone kind of comes up and towards your chest. Your pelvis is now rolling in the opposite direction from the arch. And slowly and gently, you're going to inhale or find an inhale and move back into the arch where your lower back gently comes away from the floor. Make the transition nice and slow. You can always stop and take a breath, find an exhale, contract your belly to bring your pelvis into a posterior tilt. That's where the pubic bone gets closer to the rib cage. When you inhale and arch, you're going into an anterior tilt. Let's add our arms and shoulder girdle and just keep going. And I'm just going to bring your attention to what your scapulas are doing, what your arms and shoulder joints are doing. So as you inhale and arch, roll your arms outward. This is external rotation of the shoulders, of the shoulder joint. As you exhale and flatten, roll your arms inward. Your shoulders will round forward. That's internal rotation of the shoulder joint through the arms. Let's do that again. Feel it. Understand what you're doing. Feel your arms roll outward, external rotation at the shoulder joint through the arms. As you go into flatten and curl or a flatten, roll your arms in. Feel internal rotation of the arms at the shoulder joint. Let's begin to notice what our shoulder blades are doing. As we inhale and arch and roll our arms outward, our shoulder blades are coming closer together. Don't hurt yourself. Don't overdo it. Your chest is open in the front and it's narrow in the back. Exhale, slowly transition. As you roll your arms into internal rotation and round your shoulders forward, your scapulas are coming away from each other. Now you're narrow in the front and you're broad in the upper third of your back. Inhale, arch, roll your arms out. Your shoulder blades are coming toward each other. That's retraction of the scapulas. Exhale, transition into flatten, roll your arms in, round your shoulders. Your shoulder blades are coming away from your spine. That is protraction of the scapulas, and come to rest. Okay. Let's just grow this movement a little bit with a version of arch and curl, but we're going to do the flower and I will guide you. Bring your hands behind your head if you can. because this time on the exhale, you're actually going to do a curl I'll describe as we go along. Your knees are bent, and we're going to be working with both the shoulder girdle and the pelvic girdle. As you inhale and arch your spine, your head goes back, your elbows, if you can, go back, and your knees open comfortably. You're opening the flower bud. As you exhale and transition, coming out of the contraction of the back, you're going to curl. Your hands are going to help lift your head. Your elbows are going to come closer together. You're going to squeeze your knees together, but splay your feet out. And now your elbows are coming closer. Your knees are gently squeezing together. You are closing the bud. The front of your body is short. The back of your body is long. Inhale. As you arch, you're opening the bud, the flower bud. Your elbows go back. Your knees go out. Your shoulder blades are coming closer together. Your pelvis in the front and the shoulder girdle in the front are broad. In the back, they're narrow. Exhale, curl, go into closing the flower bud. You're going to help, your hands are going to help lift your head as your belly contracts, your elbows come closer together, your knees squeeze together, your feet splay out. Slowly come back down and rest in a position of comfort. We have two girdles, a shoulder girdle and a pelvic girdle. And Tom Hanna taught us the flower. I liked it very much because I could feel both the shoulder and the pelvic girdle working together. Okay. Turn onto one of your sides, grab a pillow or two for under your head. You're going to move into the chair position. It means your knees are bent. Your ankles are under your knees, which means you can almost see your toes. And you're going to drape your top arm long on the side of your body. Drape your top arm long. Okay, we're going to start with a version of our regular lateral flexion. Knees stay together. Bring your top foot up to hike your hip and bring your armpit gently down towards your hip. Don't hurt yourself. Your ribs are squeezing on the side toward the ceiling. Slowly release. Slowly release. And we'll do that one more time. And notice where your shoulders are. If you can, both of them, even the one on the floor. See if you can feel the difference. As you're side bending or laterally flexing, your foot comes up, your hip hikes up, your hip is high. You're going to bring your armpit down. Your shoulder is low. Your shoulder and hip are coming closer together. Can you feel on the floor side, maybe you can, that your ribs are opening up a little bit and your shoulder's a little up and your hip is a little down on the floor side? Slowly come out of this and come into a gentle lengthening, your top arm over your head just to comfort your bottom leg straight down, and you're opening up those ribs on the side comfortably, and now your armpit and your hip are away from each other long, and your shoulder joint is facing more up. Upward rotation of the scapula, and come back into your neutral position with your arm at your side, draped on your side. Okay, we're going to internally rotate our arm at the shoulder. Internal rotation. You're going to roll your arm, your top arm inward. Your shoulder will come a little forward. Your arm is kind of like a rolling pin, and slowly release back to your neutral. It might come forward a little bit. That's fine. But this time we're going to combine that with the side bending. Many people not only have a side bend to one side, but they're also more rounded forward on one side. So listen to the directions. Roll your arm and shoulder inward, your shoulders forward, and bring your top foot up, hike your hip, bring your armpit down. Your arm will be a little bit in front of you, and slowly release. It's a very, what we call red light, curled, contracted, adducted, internally rotated position. And your shoulder blades were away from each other. All right, let's do that one more time. Roll your top arm inward, your shoulder rounds forward. Now, bring your foot up to hike your hip, bring your armpit down. Can you feel your ribs from your, like your top, the breast on the top downward are more contracted to the front? And slowly release and relax. When we do these things pendicularly, we're going into a contraction pattern with the purpose of coming out of it slowly so those muscles can release back into their normal resting length. Draping your top arm along your side, go ahead and roll your arm into external rotation, shoulder backward, and slowly release to your neutral. Some people are very rotated with a shoulder backward, and they're also flexed to a certain degree, laterally flexed. So listen to the directions. You're going to externally or outwardly rotate your arm. Your shoulder will go back. Hold it there a little bit. Hike your hip. Bring your foot up. Hike your hip. Bring your armpit down. Your armpit is a little behind you. And now your upper body is rotated backward on the top and your pelvis is rotated forward on the bottom. And slowly release. You've got an opposite rotation, upper body to lower body. We're going to do that one more time. A very common posture for people to be stuck in. Once again, roll your arm outward, shoulder a little backward, holding your arm in that position. Bring your foot up, hike your hip, bring your armpit down. Your upper body is rotated backward and down. Your lower body is rotated a little forward and inward. Your thigh is rotated inward, and slowly release and relax. And turn over onto your other side. Drape your top arm. Make sure your head and neck are comfortable. We're going to do our regular lateral flexion, but our arm is going to be down. Notice that the side up toward the ceiling, that shoulder is going to be positioned downward. So you're going to keep your knees touching, raise your top foot, hike your hip, bring your armpit down, which means your arm gets a little longer. Your ribs are coming together. Your shoulder is low. The shoulder on the floor you may be able to feel is a little high. The ribs on the floor may open up a little bit. The hip on the floor may be down compared to the hip toward the ceiling is up toward the armpit. Slowly come out of that and relax. The position of the shoulder girdle and the position of the trunk and spine are completely interrelated. Okay. Once again, same thing. Bring your top foot up, knees stay together, hike your hip, bring your armpit down. Feel you have a short side, that's the ceiling side. You have a long side, that's the floor side. Slowly release. And lengthen your top arm and leg. Just be comfortable with your arm. Do not force it. Your leg is long. And slowly come down and relax again with your top arm draped. All right, your top arm is along your side. You're going to internally rotate your top arm. Your shoulder's going to round forward. Notice your shoulder blade, especially on the ceiling side, is going away from your spine. Slowly release. Mostly the shoulder and shoulder girdle completely work together, and the scapula. This time we're going to add it with lateral flexion. Roll your arm inward, bring your shoulder forward, keep it there while you bring your top foot up, knees stay together, hip hikes up, armpit comes down. Now you are shortened and much more red light and contracted on your ceiling side, upper quadrant and lower quadrant. Very red light move up and down the top half of your body, and slowly release. And if this feels really good, you really need it. If it feels really strange, this is not your usual pattern. Let's do it one more time. Roll your arm inward, shoulder comes forward, hold it there as you bring your top foot up to hike your hip, your armpit comes down. The whole front side of you is forward and short and flexed and adducted. And slowly release and relax. Good. Now, let's roll our top arm into external rotation, brings the shoulder backward. The shoulder blade is coming closer together to the bottom one. Your shoulder is pulled back. You're more open in the chest on the front. Slowly release. And let's combine that with side bending. So I like to do this on an inhale. It's sort of natural because there's a sort of a natural arch with this. Inhale, roll your arm into external rotation, shoulder backward, hold it there. Knees together, top foot up, hike your hip, bring your armpit down. Now your shoulder is rotated backward. Your pelvis is on the ceiling side is rotated forward. Slowly release. It's actually a contralateral rotation on the side. Let's do that one more time. Your shoulder joint arm are rotating into external rotation. Your shoulders coming backward closer to your spine. And you're going to keep it there. You're going to keep your knees touching, bring your top foot up, hike your hip, bring your armpit down. Feel that your upper body is rotated backward and down. Your lower body is rotated forward and a little bit up. And slowly release and relax. Let's take one more lengthening. I don't know if I did on the other side, but it's nice. Let's take one more lengthening, top arm, top leg, opening up the ribs on the ceiling-ward side. Your shoulder joint is pointing up. Your scapula is upwardly rotated. Your hip is pointing down. It's your long shoulder to hip now. And slowly release, roll over onto your back and relax. Give yourself a moment. One leg at a time, bend your knees, put your feet on the floor. We're going to do a kind of an interesting combination of twist in the lower body and a kind of rolling arch and curl in the upper body. Just come along with me. Bring your right hand behind your head. You're going to leave your head down on the pillow or floor and just do you're not going to be lifting your head at this time. You're going to turn your face to the right, turn your rib cage to the right, bring your right elbow backward into the floor. You're rolling and rotating your upper body right. And slowly come back to center. Okay, now your right arm is still behind your head. As you turn your rib cage and face to the left, let your elbow come along. Your elbow will get closer to your face, and you're rotating your head, neck, ribs, a lot of your trunk, and you're bringing your elbow closer to your head. And now come back to center. So you're rolling in both directions with your right hand behind your head. Now we're going to combine that with the lower body. Bring your knees comfortably to the left. Turn your face to the right. Turn your rib cage to the right. Bring your right elbow into the floor. Your lower body's going left. Your upper body's going right. Now you're going to reverse that. As you transition your knees to the right, your face, rib cage, torso, your right elbow will come closer to your head, and you're rotating your upper body and your arm and shoulder blade so that your elbow can go more to the left. And go ahead and start to transition. Your knees to the left, roll your upper body, your trunk, your rib cage, or your upper trunk, your rib cage, your face to the right. Your elbow goes more into the floor if it can. Now start transitioning your knees to the right, your upper trunk, head, neck to the left. Your elbow's going to come closer to your face. Don't force it. And to the left. And come back to center. And relax. Now, bring your left arm behind your head. Let's practice the upper body. You're going to be turning your rib cage and your face to the left. Your left arm goes into the floor. And slowly go through your sort of neutral, and now turn your face and your rib cage to the right. Your left elbow comes closer to your face and starts to help bringing your face and trunk to the right. And slowly come back to your starting position. Do the best you can without hurting yourself in your shoulder girdle in this position. Let's combine it with our knees. It's a version of the twist combined with some diagonal arch and curl. Knees to the right. Turn your rib cage, your face to the left, left elbow into the floor if you can. Slowly begin to transition through your neutral, knees to the left. Now turn your face, your rib cage to the right, your elbow, left elbow comes closer to your face and to the right. And slowly transition, knees to the right, upper body, face, elbow to the left, elbow into the floor if it can. One more direction, knees to the left. You're beginning to transition anyway. Through your center, knees to the left, upper body rotates right, face right, rib cage right, right elbow comes closer to your face and points more to the right. And come back to center. and relax in any position of comfort. Last or second to the last movement, let's now go into a regular twist. Bring your arms out from your shoulders like a T. Unless that's stressful, then you can bring your arms lower on the floor. And knees to the left, face to the right. Right arm rolls more palm up, left arm rolls more palm down. And now you're going to transition knees to the right, face to the left, left arm more palm up, right more palm down. Keep going and see if as you keep going, you can describe to yourself what kind of rotation is in your right arm, what kind of rotation is in your left arm, and then make the transition and see if you can feel those rotations through the shoulder joint and the arm. The scapulas are playing a role. We'll get to that in a moment. But see if you can understand sensorially what rotation are your arms in, shoulders down to the hands, and your face is usually following the upper arm. So your head and neck and face are all rotating as well. Now see, as you continue, see if you can follow the scapulas in the following way. Go to one side or the other, whichever way you are going next, and just stop in that position for a moment. One of your arms is rolled into external rotation. That's the more palm up arm. One arm is more into internal rotation. That's the palm down arm. Now, in the arm that's rotated down, your scapula is sliding up towards the top of your shoulder. In the arm, let's see, in the internally, I don't know if I said that right. In the internally rotated arm, that shoulder blade is riding more up towards the top of your shoulder. In the arm that's in external rotation, the more palm up arm, that shoulder blade is depressing down or gliding downward in your back. There's an inverse relationship now reverse it. See if you can follow what's happening in your shoulder blades. One shoulder blade is gliding up. That's on the downwardly rotated arm. One shoulder blade is gliding down, and that's in the external or upwardly rotated arm. See if you can feel that the shoulder blades need to glide more up and down as the arms rotate. The externally rotated arm, the shoulder blade glides down. The internally rotated arm, that shoulder blade glides up. Come back to center. Leave it alone. We're 1 minute over. Let's end with just some arch and flatten. If you have the time, I understand if you have to leave. If you have the time, it's nice to begin and end the floor work with some version of arch and flatten or arch and curl. If you want to choose another version because you know somatics well, you certainly can. You can even do your arch and flatten with your legs long if you want. It makes it smaller. I like to do both positions a lot. And just come back into that nice, slow, rhythmic arch and flatten. Your head and neck are moving. Your arms and shoulders may slightly move. They may not. Your breathing is comfortable. And end on an exhale, flatten. Give yourself just a few seconds to relax. And that's going to officially end our class today. I love to have time to get up and stand up and to walk around, which I suggest you do, but officially it's not going to be part of the class today. However, I am going to stay online if you want to talk or have questions or want to understand something better. So I'm going to turn the recording off.